This week's Medical House Call, Sherry Falk looks at an issue that many people have but really don't like to talk about. That's bladder leakage.
Yeah, stress or urge incontinence is usually caused by weak pelvic muscles, and a local nurse practitioner has an at-home therapy to cure this embarrassing problem.
It's an embarrassing problem for women. We don't want to tell people that we're wet.
Embarrassing, but happening to more people than you think. People of all ages. One cough, sneeze, or too much laughter, and it slips out.
Some women now have gotten to the point where they believe that as you get older, you're just going to leak. That's not true. It's not normal. There are definitely things we can do to stop that.
Nurse practitioner Ashley Ford says about 2/3 of women suffer from incontinence and never even mention it to their physician unless asked about it.
You have stress incontinence and urge incontinence. And so obviously urge is when you feel the urge to go, but you can't make it to the bathroom. And stress is when you have that increased abdominal pressure, like coughing and laughing and sneezing.
The only way to stop incontinence is by strengthening your pelvic floor muscles, which is also known as doing your Kegels. But Ford says 50% of women can't tell if they're doing it right. But InTone will solve that problem.
This device works in two ways. One, it gives you a small amount of intravaginal electrical stimulation that causes both short and long muscle fiber stimulation. So essentially it's exercising that muscle for you. As you're feeling that stimulation, you also are better able to isolate that muscle group. The second way this works is you literally have a therapist in your hand telling you and showing you how to do these exercises.
It's a 12-minute program done in the privacy of your own home once a day for 90 days. After that, it's all about maintenance therapy to ensure you no longer leak.
Unlike your medicines, your oral anticholinergics, you don't have that risk of having dry mouth or constipation. Unlike surgery, which has the adverse events of possibly having a reaction to the mesh, possibly having to repeat your surgery in the future, there is no risk of adverse effects with this.
In Ford's experience, patients are seeing positive results after 2 weeks, and after 6 weeks, they're completely dry. For 7 on Your Side, Sherry Falk.
The only side effect that the FDA reports is orgasm. There are also some people that aren't good candidates for this device. Folks that have a pacemaker, copper IUD, and you must be at least 6 weeks out from delivery or any type of bladder surgery.